Cosatu is calling for better security at Eastern Cape health facilities. It follows the murder of a nurse at a Mqanduli hospital. It's alleged the killers inquired about a patient just after 7 a.m. While the nurse was looking for the patient, they grabbed her, dragged her outside and shot her twice. Let's discuss this more now with Cosatu's Eastern Cape Provincial Secretary Mkhawuleli Makeli. Mr. Makeli, good morning and thank you very much for your time. What a horrific incident. What more do you know about the circumstances surrounding this killing?
Good morning to you and the viewers. Nothing much I know as of now, other than that these two men, they came into the hospital. They just inquired as if they're looking for a patient, but they grabbed the nurse outside of the building and shot her.
And nobody knows at this point if they're in any way linked to the deceased?
Not that I've heard of. The investigators are working very hard on the case, and we are looking forward to hear from them.
And then what has been the hospital's response, or better yet, perhaps to start with just getting context around the security of this particular hospital? What do you know insofar as security is concerned with that hospital?
Well, if you look at the security around the hospitals in the Eastern Cape, I would make mention of the Livingston Hospital, where you find gangs in the northern areas. They would shoot at each other, but they'd go to the hospital and finish each other off in the hospital because of the lack of security. This is the situation that confronts us, and where you find security personnel are more like administrative staff that would jot down the names when people come in, search them, and then they leave. The problem, in my view, in our view as Cosatu, is that their training and their equipment needs to be beefed up. You cannot have a person in the security who wields a baton only as a weapon. Nothing beyond the weapon. The grade of the security in the hospital needs to be beefed up. There to be better quality, but also in terms of the equipment. Because even if they did not know who the people were, and what they came in for, when they dragged a person out of a personnel, a staff member of the hospital out of the hospital, something.
Mr. Makeli, I don't know if you can hear me. Oh, it's unfortunate we've lost Mr. Makeli there, because we still wanted a bit of information around whether the security there at the hospital is outsourced, because that would be then the responsibility of the company to ensure that the grading is adequate and they're adequately resourced. Mr. Makeli, I don't know if you're still on the line. My question now is just around whether these personnel, the security personnel, was it internal personnel, or it would have been outsourced in this instance where there's a particular company that was awarded the contract?
It's outsourced personnel, but even if it's an outsourced personnel, the hospital has a responsibility that it cannot abdicate, regardless of who renders such services. And how our union has been saying from time after time that there has to be insourcing of the personnel, the cleaning personnel, as well as the security personnel.
But then it's concerning if it's outsourced, because that means we're not getting value for money.
It is indeed. That's one of the challenges that the department has to look into.
Now, as Cosatu, have you challenged the hospital to at least get some sort of an explanation from the company, and perhaps even dismiss the company?
We're busy engaging with the provincial department insofar as that matter is concerned.
And what has broadly been the response of the hospital following this incident?
Well, they say they would have a meeting with us, and as well as NEHAW, the union that is in charge there in the hospital, so that we can take this matter forward and look broadly, not only that isolated incident, but broadly at the security in the hospitals.